Today, sir, I am Noraifa Kapampangan, and for today's video, I will be performing a return demonstration, which is the eye irrigation procedure. So, eye irrigation is used to flush particles and harmful chemicals from the conjunctiva and the cornea, and it can also be used preoperatively to prepare the eye for surgery or to manage infection. And the purpose of this procedure is to treat inflammatory condition of the conjunctiva and to apply heat or cold to the eye, to apply medication, and to remove foreign particles or irritating chemicals falling in the eye, and also to relieve congestion and pain. So to begin with the procedure, you have to confirm patient's identity by asking for full name and date of birth, or confirm identity with a family or carer, and explain procedure and obtain valid consent, and collect and check all equipments. And patient to be encouraged to sit or lie with head well supported in a position they find comfortable, and ensure a light source is adequate, and decontaminate hands prior to procedure. So open sterile dressing pack onto a clean field and place all sterile single-use equipment required within sterile field. And then apply single-use disposable apron. So assuming that this is an apron. And after that, you have also to apply single-use disposable sterile gloves in a manner which prevents the outer surface of the sterile gloves being touched by a non-sterile item. And using a aseptic principle to ensure that only sterile single-use items are used to keep exposure of the susceptible side to a minimum, and always bath the lids with the eyes closed first. So for the lower lid, using a sterile gauze swab moistened slightly with normal saline, ask the patient to look up and gently swab the lower lid from the nasal corner outwards only, once only. So sir, can you look upward po? So you have to swipe the eyelid from inner to outer. And then using another swab, you have to swipe at the another part. So ensure the edge of the swab is not above the lower lid margin to avoid touching the cornea, and use a new swab for each wipe until all discharge has been removed. So from inner to outer. So for the upper lid, using a sterile gauze swab moistened slightly with normal saline, gently swab the upper lid by gently lifting the eyelid margin and asking the patient to look down from the nasal corner outwards once only, and avoid touching the corner. So, sir, can you look downward po? And then use a new swab for each wipe until all discharge has been removed. So on completion of procedure, remove and dispose of personal protective equipment or PPE to comply with waste management policy, and decontaminate hands following removal of PPE. And if signs of infection or inflammation are noted, or inform physician, and ensure patient or client is comfortable following procedure, and document all actions and observations in nursing records. And that would be all. Thank you.